Hi, everyone. Thank you so much for having me today. I've really enjoyed the forum thus far, and I'm really privileged to be able to share some early work. This is a flash talk, but also kind of a work in progress, and I'm really hopeful to get some of your feedback and thoughts on how to take this project forward. Sort of the caveat being is I moved to Boston in August. So I'm still learning the lay of the land. And when it comes to things like counties, you'll see that I'm still sort of clueless and looking forward to hearing your thoughts. So my title today is Assessing Education Data to Understand the Intersection of Homelessness and Disability in Massachusetts Children. And so suffice to say, I think the US is in a housing crisis. This is a map from the Department of Housing and Urban Development from 2020. So this is even pre-pandemic. We see that across the country, especially on the East and West coasts, a lot of states have a high population of people experiencing homelessness, and Massachusetts is one of them. So this is 2018 data from Massachusetts that says, they found that 26.1 in every 10,000 people were experiencing homelessness, which was an 18.8% increase from 2007. Being here on the Boston Medical Campus, it really is close and something that we see every day, and it's important to work towards finding housing for this population and improving opportunity. Among this population, HUD reported that 11,742 were people in families with children. So while that number is a little confusing, I think that includes parents and children. There is a substantial proportion of children that are experiencing homelessness. And among those, 481 are considered unaccompanied homeless youth. On a pivoting a little bit, Massachusetts also is a great state for special education services. And 18% of students in public education receive special education services. This is data from the IDEA that shows, compared to the national statistics, each year from 2009 to 2018, Massachusetts has served about 4% more students with special education services, 4 percentage points more. It's about 25% more in that scale. So both these populations, those students experiencing homelessness and those with disabilities, are protected by federal laws that mandate appropriate education for these vulnerable populations. For students experiencing homelessness, there's the McKinney-Vento Homeless Education Assistance Act, which ensures students experiencing homelessness have equal access to public education. The act requires that students have the right to immediate enrollment in a school, and that school district appoints education liaisons. The Individuals with Disability in Education Act makes available free and appropriate public education to children with disabilities from ages 0 to 21. And the law enables the federal government to work with states to provide education and services that meet a child's need and prepare them for further education, employment, and independent living. So both of these are federal laws, but the implementation really comes in at the state level, and states have the opportunity to provide services the way they see fit. And so here comes sort of the intersection is what we're interested is this population of children with disabilities that are experiencing homelessness. There is some research that suggests that this is a group that, or students with disabilities is a group that experience homelessness more often. We'll talk about a little bit of the potential mechanisms in a second. But because this group is facing these two vulnerabilities because of the structural system we exist in, it might be an area in a group to really focus on to improve interventions and identifications that can help long-term outcomes. So potential ways that this population enters these two groups, a family circumstance, socioeconomic status, might lead to a family to experience homelessness. And because of those traumas and experiences and potential aggravation in already borderline scenarios, that might lead a child to be identified as having a disability. Conversely, a child might have a disability that puts a family under financial stress that leads to them experiencing homelessness. And then the family circumstance might collinearly or at the same time lead to the family to experience homelessness and a child to meet disability criteria. I think it's important to think about sort of these mechanisms because the ultimate goal is to prevent the homelessness. And by thinking about where we can intervene on family circumstance and programs and structural changes, it's important to think causally. So the goal of this project was to use existing data to document and describe the percentage of students experiencing homelessness who also received special education services in Massachusetts in 2017, 2018. This is really the important first step to start doing this work to make change. And we want to identify counties where students experiencing homelessness are over or underrepresented in special education. And I'll talk a little bit more about what we mean by over or underrepresented when we get there. So it's important to think about this as how we define these topics, because these are federally mandated statistics that are collected. There is a rigid definition that really may not capture all students experiencing homelessness or students experiencing disability. So that's a limitation of this project, but it's the world we're working in for this study. So the McKinney-Vento Act defines homelessness as fixed, regular, and adequate housing. And disability here, we're considering it the receipt of an individualized education program or individualized family service plan. So the data come from, as I mentioned, sort of federal statistics. Under the McKinney-Vento Act, the states submit data at local education agency level on the number of students experiencing homelessness enrolled, the number of students experiencing homelessness with disability, the type of housing situation, English learner status, and migrant status. So these data that are provided, they do not have denominators. So it could say in the Boston School District, there are 10,000 students that experience homelessness, but you can't make that a percent because it doesn't tell you how many students are in the Boston School District. So we need to supplement that with Massachusetts Department of Education data, and they collect enrollment data from public schools to meet the federal and local guidelines. So this data is used to analyze and inform practices and policies in the state. So what we did is we linked these two data sets based on district, which was either sort of the group or individual schools like charter schools that are considered a district in the data. We used the 2017-2018 school year because that was the most recent data for the homelessness data. So we calculated the percent experiencing homelessness, the percent experiencing homelessness with and without disabilities by district and county. And we calculated relative risk to sort of understand how much more homelessness we were seeing in the disabled population compared to the non-disabled population. And then we did some mapping of results at the district level. These are some preliminary maps that I think look cool, and I'm interested to sort of think more about interpretability of them. So what we found is in this school year, there were 962,297 students enrolled in Massachusetts public schools. About 25,000 experienced homelessness, so that was about 2.6%. There were about 177,000 students with recognized disability. That's a typo there. So which is about 18%. And of those students, 3.5% were reported to experience homelessness. So when you compare those numbers, homelessness was 50% greater for children with disabilities compared to children without disabilities in 2017, 2018 in Massachusetts. When we look by counties, as I mentioned before, like the only county I really know is the one I live in Suffolk, but the range for students with disabilities was pretty stable between 14 and 20%. But then we see some states have some counties have students experiencing more homelessness. Suffolk was the highest at 6.8%, with Dukes being or actually Nantucket reported no students experiencing homelessness. When we get to disability versus non-disability, in all counties, students with disabilities experienced more homelessness than students without disability. When we look at the ratio, so comparing with to without disability, the ratio ranged from 30% higher to 120% higher. So consistently in the counties, we're seeing students with disabilities are more likely to experience homelessness. So these are just some cool maps. This is the distribution. This is percents of students with disability. It's pretty neatly distributed across the map. For those that experience housing issues, we sort of see a cluster in the Boston area and sort of here in the more western part of the state, as well as on the Cape. Similar when we're looking at students with no disabilities, that's just the previous data subtracting out the students with disabilities. And then again, this is the percent of students with housing issues and a disability. We're seeing sort of a cluster in Massachusetts, in the Boston area and sort of in the western part of the state and the Cape. And then this is that ratio I was talking about, comparing students with and without disabilities. This is one we sort of need to think about more and how to interpret. But you'll see there are some of these more orange and red areas around the state signifying a really big discordance in the two groups. So to sum up, in this school year, students experiencing homelessness were more likely to have a disability compared to peers. Or you can interpret it as in the 2017-2018 school year, students with disabilities were more likely to experience homelessness compared to peers. There's sort of this data was taken at the same time, so we don't really know what came first. They may have come at the same time. The disability may have preceded the housing situation. We're going to need different data to understand these patterns more, but we're looking forward to dive deeper into it. So there were more students with disability experiencing homelessness. Does this mean they're overrepresented in the homeless population? It might. It might be that because of disability, their families are struggling economically, leading to homelessness. And this overrepresentation may not necessarily be bad. We want these students to get the services they need. However, because we don't really know how these students are identified, whether students are not being identified as either experiencing homelessness or as having a disability, this could still be a big undercount. We might be missing a lot of kids with disabilities that are experiencing homelessness because they are not getting an IEP, because they're in and out of schools, or for other reasons. So again, something that we need to explore further. We think that we made some steps forward here by identifying this area with a large intersection. We've added to the data by getting these into percents rather than just counts. And we need to think about how to best serve these vulnerable children. Some limitations, these are ecological data. We didn't have any data on an individual person. So we don't really know about language spoken in the home or other factors that might be important to understand these results. As I mentioned, it's hard to decipher this over or under representation. And again, our results are impacted by how the state and the federal law defines homelessness and disability. So I'm really excited to talk to you all in the breakout room. My email and Twitter are here if you have any questions or comments that you would like to send that way. Thanks a lot.